Hi, I'm Tosin. Depression is a very common mental illness. But what exactly is depression? And how do you know if you or someone else has depression? Also, if depression occurs, is there anything we can do? What's the difference between depression and general unhappiness? Is depression simply a feeling of low mood for a period of time? This issue actually involves the definition of this matter in psychology as, is it just a problem that I feel? Or is it serious enough to cause a mental illness? Generally speaking, there are three criteria to define in psychology. The first is that your reaction to something is far beyond social norms. For example, bereavement or loss of a spouse, or a drastic change in work and life patterns. These are indeed stressful events. It's normal for us to feel down emotionally when faced with these situations. But when a person experiences these unfortunate events, for example, 1 year later, the mood is still very low. 2 years later, the mood is still very low. 5 years later, the mood is still very low. The life becomes a mess. This is probably a mental illness. The second criterion is that the matter causes great distress to you. People also felt that these issues were very troubling. The third criterion is that these psychological symptoms prevent normal functioning of life, including career, family, and relationships. In these aspects, some psychological symptoms make it impossible to live a normal life. Generally speaking, your psychological condition is consistent with these three criteria and has become serious to a certain extent. We would define this as a mental illness. What we talked about earlier are some general aspects. If we want to define whether we have one of the mental illnesses, most psychologists will refer to a book called DSM-5. This book defines the diagnostic criteria for all mental illnesses. Of course, some of the guidelines are vague, therefore whether you have a disease or not must be left to professionals to determine. Let's take a look at how to judge whether a person has depression in the DSM-5. In fact, depression is not a single mental illness in this book. There are different types of depression. One of them is called persistent depression disorder, also known as PDD. PDD is not as serious as what we generally call depression, but the timeline of this disease is relatively long. It may take 1 to 2 years before the disease is diagnosed as PDD. The type of depression that everyone talks about most is actually major depression disorder, or MDD for short. So how do we determine whether a person has MDD? Let's take a look at the criteria in DSM-5. In DSM-5, there are 8 diagnostic criteria. To define the mental illness like MDD, there are 2 core criteria. One of them must be met before it can be called MDD, which is the kind of depression we usually talk about most. So what are these 8 criteria and the 2 most core ones? The first criteria is the depressed mood. That is, you feel that your mood is very low. This is the first core criteria. The second is that you have lost interest in things that you usually are interested in. This is the second core criterion. Of these 2 core criteria, you must meet one of them to be defined as having a mental illness like MDD. Other symptoms include, for example, third, a dramatic loss or increase in one's weight. The fourth is insomnia or excessive sleep. The fifth is that you feel like you want to move your body every day, or on the contrary, you don't want to move every day. You feel very tired and lose the energy you normally have. The sixth is that you feel that you are worthless person, or your sense of guilt is extremely strong. The seventh is that you feel that your thinking ability is not as good as before, and you cannot make decisions or make judgments quickly. The eighth is to often think about death or have suicidal thoughts, or even make actual suicide attempts. You must have 5 of these 8 symptoms and one of the first 2 symptoms to be diagnosed with MDD. Now that we have talked about the definition of depression, let's talk about the causes of depression. Regarding the causes of depression, different schools of thought actually have different opinions. At the same time, everyone has different psychological qualities. For example, some people are more extroverted, some people are more introverted, some people are more sensitive, and some people are not so sensitive. Innate genes actually have a greater impact. Some studies even roughly estimate that 40% to 50% of depression may be hereditary. Not only genes, but the environment around you also have a great impact on the formation of depression. For example, your genes may have a very strong tendency to cause depression, but your life is stress-free and comfortable, or it makes you feel meaningful and fulfilling. Such people may not eventually develop depression. Or sometimes it's the other way around. For example, a person's original genes may not be prone to depression, but when this person is in a very unusual environment, for example, the pressure brought by work and life is very high, then these factors may cause you to develop depression. Simply put, depression or other mental illnesses are related to two factors, one's own genes and environmental stress. So in terms of environment, what factors can cause people to suffer from depression? There are many different conclusions in this regard. One of the more famous ones is cognitive triad, proposed by Aaron Beck. That is to say, when we have a negative view of ourselves, our future, and the world, it can easily turn into depression. For example, when we feel that we are a bad person, we feel that it is difficult for us to have a good future, and we feel that the world is hostile to us. In this triangle, these things can easily form a vicious cycle. The feeling of powerlessness, the discomfort, and the embarrassment to oneself, these factors can easily lead to depression. That is the MDD mentioned above, or it may be a longer term, relatively less severe form of PDD. We have finished talking about the definition of depression and the causes of depression above. If we or someone around us suffers from depression, how can we deal with it? Generally speaking, there are two types of professionals who can help us treat depression. The first category is clinical psychologists, and the other one is the psychiatrist. The methods they use are different. Clinical psychologist mainly uses a method called talk therapy. That is what you usually see on TV. The patient is in a treatment room, and the clinical psychologist will try to help you solve some psychological problems through chatting. But even among clinical psychologists, the methods they use are very different. People from different sects have different understandings of the same symptoms. One of the more popular therapies is called cognitive behavioral therapy. This treatment method attaches great importance to identifying some people's dysfunctional thought. For example, a person named Alex, he just found out that all his friends had invited him to hang out, but they hadn't called him. Therefore, it is possible that some irrational thought may arise due to this matter. He will feel that no one likes him at all. He will find that his idea is not only completely unhelpful to him, but also, moreover, it is not reasonable. For example, if one of his friends ignores him, does it mean that everyone in the world dislikes him? In fact, this may not be the case. During this treatment process, psychologists will point out the irrationality of this thought and resolve your unhappiness. Of course, this is not the only way. In fact, there are many other various sects. They all look at the same thing from different angles, but due to limited time, we will not explain them one by one. Genes are closely related to whether we will suffer from depression. In other words, these diseases are closely related to biological categories. Psychiatrists will prescribe some psychiatric medications. For example, one of the more common antidepressants is Prozac. These drugs relieve some of your symptoms of depression by affecting the functioning of neurotransmitters in your brain. Finally, you may ask, if you or your friends around you have depression, how can we alleviate it? First of all, of course, with depression, you need to see a professional, including the clinical psychologist and psychiatrist mentioned above. But if you only have some mild symptoms of depression, in fact, in many cases, we can make some changes in our lifestyle. This includes, for example, doing more exercise, seeing more friends, or changing the way you think about yourself. Through this method, our depressive symptoms will be relieved to a certain extent. The most important thing is that we often have to accept our feelings. Depression is like other diseases, such as cancer and pneumonia. It is not necessarily because you have done something wrong to get these diseases. Sometimes you really don't know why. It may be that the neurotransmitters in the brain don't operate in the way you want, and people suffer from depression. Sometimes these things may not be our own responsibility. In fact, we are all victims of the disease. This attitude is very important for yourself and for supporting friends who are suffering from depression.